Hello, this is Amanda Smith and Rita Smith, and we're doing the physical assessment for week 5 health assessment. We're going to be doing the respiratory assessment today. So when you come in for a respiratory assessment with your patient, it's going to be a little different for this assessment purposes because I'm going to be verbalizing some things that I wouldn't be verbalizing to the patient when I go in and do an assessment, but in terms of this video, I am going to verbalize so we can kind of follow along with the respiratory assessment. So when we initially come in, we're observing the patient. What does their color look like? Are they having any difficulty breathing? Is their trachea midline? Do they have any jugular vein distension or distension of their carotid artery in their neck? Are their nostrils flaring? Does it look like they're working hard to breathe for a respiratory assessment? Are they answering questions in full sentences, or are they having to take a deep breath in between every other word? That type of thing. How their color is. Are they getting enough oxygen to their tissues? So, and then after my patient right now looks normal, not having any difficulty breathing, trachea is midline, I don't see any vein distension in the neck, her color's good. So then after that, we're going to go to the palpation. So we come up to the patient and we're going to be, spin the chair this way, palpate the supraclavicular area up here, kind of feeling for the lymph nodes, is there any swelling or anything, and then we just move down and kind of feel in the intercostal space, each rib. Is there any pain, swelling? Are there any like abnormal masses or anything like that? We go under the arm, go down. Having any pain or anything?
No.
You doing this?
No.
Okay. And the first rib starts right about underneath the clavicle here, and then you can kind of follow each rib and space as you go down. So I'm not feeling any abnormalities. Everything feels pretty good. The sternum is midline. I'm going to go around to the back. And then kind of the same thing down the back. You can feel like each rib space, any swelling, pain, tenderness. And while you're doing this, while you have your hands on your patient, you can kind of take note of how they're breathing, like what their rhythm and quality of each of their breaths. Are they chest breathers or belly breathers? That's important to take note as well. Normal respiratory rate is 12 to 20. It kind of differs on what text you read. It could be 12 to 18. Some people say 12 to 20. Some are even a little higher, like 12 to 24. But right in that range. And then after we do the palpation, we go to the percussion. And what you do is you take a hand and kind of spread your fingers out and start up here and take your other hand and kind of have your middle knuckle just a little bit protruding and just make a slight 2 knocks and listen for the sound to your middle finger to middle finger. And you just go down. We want a resonant sound. If it's too dull or too like high pitched, it could mean that there's too much air in the lungs or there's too much fluid in the lungs, such as emphysema or pneumonia. We're going to go other side. Okay, and everything sounds about even in the anterior portion of her chest, so we're just going to go back to the posterior section, and we're going to move the chair back a little so you guys can see more of what my hands are doing for the percussion. Okay. I'll just lean forward a little bit. Okay. And if you get too far down the back where you kind of get into this space where beneath the lungs, you'll hear a different sound when you do the percussion. So everything for this patient for percussion checks out okay. I'm going to move back again. Checks out okay for percussion. So then we go to the auscultation of each lung sound, each lung field. So just go ahead and take a deep breath in and out. Start at the apex of the lungs, sounds clear, and then we're just going to move down. We're going to go to the side. The other side. Okay, then we're going to spin the chair around again. So when you're listening to lung sounds, what you want to hear is just a clear inhale and exhale. You're listening for if there's any like pleural rubs, any friction in there. You're listening for crackles, wheezes. We're actually going to go back around to the front in a minute, and we're just going to put the auscultate over the trachea, because with that you can hear any stridorous sounds or anything like that, that there might be indication of a blockage in the trachea. So we're going to keep going down the back. And always when you auscultate breath sounds too, you want to go in from each side of the lung so that you can compare both left and right lung in the same lobe. Starting at the apex. Everything so far is clear. When you get down to the bases of the lungs is kind of most likely where you might hear some crackles, especially in people who don't move around as much because that fluid settles into the base of their lungs. Okay, so that was all good. Then we're just going to real quick check the trachea. So go ahead and breathe in. And that sounded good. So the 4 steps of the respiratory assessment: observe, palpate, percuss, and auscultate. That was all covered in this video, so I hope it was informative, and thank you for watching.